So we're here with Dr. Azim Kasmani, Public Health and Preventative Medicine Resident Physician at Queen's University for our weekly visit. Hi, Dr. Kasmani.
Good afternoon, Steve. How are you?
Quite good, and I think that we're all feeling a little bit lighter-hearted these days. Spring is coming, and as long as we get out and enjoy the sun 6 feet apart from each other,
Exactly.
you know, we're all looking forward to that, I think. So I guess that's the big news this week, is that it appears that at least locally, we've been really lucky. We've flattened the curve. Almost all of the cases are resolved, with none of them being resolved by a death, which is really nice, and only, 2 cases in the last week.
Yeah, we've had a couple of cases here and there, but no widespread community transmission. And it was, as we've been talking about for a couple of weeks, it really shows the efforts the community is putting in, how seriously the community is taking this, and we're very thankful to them for taking this seriously. And it's a result of their hard work and their actions that we've seen this happen. And that's bought us more time. It's made sure that we have time to prepare, time to find potential treatments, make sure our healthcare capacity exists, and make sure that at the health unit we have the capacity to find cases and do contact and case management.
Okay. Churchill once said about I believe it was about the Battle of the Britain, that this is not the beginning of the end, it's the end of the beginning. Is that what we're facing right now? Sort of the end of the first wave and just all hands on deck waiting for the second wave?
I think that's a very apt analogy there. And Dr. Natasha Crowcroft, who's a public health specialist, she described it on her Twitter as it's the first peak in a mountain range. And so different mountains will be different heights, different widths, but it's the first step in that journey. And so we should be very proud and happy to have reached this point, and we should congratulate ourselves and really celebrate that, but know that it's not the end of the road yet over.
And we can't rest on our laurels, just because
Exactly.
it seems that things are good. We can't say, okay, we can just go back to normal. The reason it's good is because we've been social distancing. I think in Kingston we've done a remarkable job of looking after our neighbors.
Yes, exactly as you're saying. We've done a great job of looking out for one another, taking the advice of public health and the government, and we've really helped this situation quite a bit by doing that.
The other, of course, news story this week, the other headline is not as good a one, which is that we've finally had our first long-term care infection. Without going into any details about that, was that something we were expecting, and is it, should we be as concerned about it given the what's happened in other communities?
Yeah, so at Public Health, our main focus over the last few weeks has been looking at those congregate settings, wherever they are in our community, and the high-risk populations, and ensuring that we have plans in place to support those organizations or those groups if they have a case there to prevent a broader outbreak. Across the province, we're really seeing that the community transmission is not the significant driver right now of the increase in cases. It is those areas, like the congregate settings, long-term care homes, for example. And so that's where we're trying to ensure that if cases arise, we can stop them from becoming outbreaks and use our identification. So the ministry has put into place very rigorous testing of quite broad and rigorous testing of people who live in those types of settings, especially long-term care homes, and supports for them to ensure that we can stop the outbreaks from spreading there, as we've seen elsewhere in the province.
The other thing that seems to be on people's minds these days that's come to the forefront is it was recently reported that there was a 40 to 60% drop in ER visits. People obviously, I think, are doing it not necessarily because they're scared, but because they're concerned that they're going to put a stress on the healthcare facilities, and they may be overlooking things that should get looked at post haste. What's your do you have any concerns about that?
Yeah, we've seen that happen in a lot of areas across the province. And one thing we keep in mind is that the reason for flattening the curve is to ensure healthcare capacity exists to treat people who need to be treated. And so if you have an emergency, if you need to go in for something, you should. And that's knowing your body, knowing yourself, and knowing when you need to go in to seek care is an important part of that. So it's hard for me to say, well, if you have this list, if you feel you need to go in, you should consider it. And you should call your family doctor if that's available, and try to get some information from them. They may be able to help you. But it's really important because we don't want things to get worse people before people finally decide to go in. So where I used to work in surgery, for example, we would have people who came in early, they had early appendicitis, it was easy to deal with. Later on, if that appendicitis was complicated, the appendix burst, there was an abscess, it would be much more difficult to treat. And so we would like to avoid that, and that's one of the reasons we are trying to flatten, or we have been trying to continuously flatten the curve, and one of the successes of that is that it leaves the healthcare capacity open to treat people who need to be treated for all of the other things that keep happening.
Oh, exactly. And Telehealth Ontario would be a good resource for that too, wouldn't it? People are probably thinking, well, I'll only call them if I'm worried about COVID-19. But if you've got some
Yeah.
other symptom and you're wondering whether you should go to the ER, Telehealth can give you some answers, can't they?
They can. They're available. I must admit, I'm not sure of what their timelines are like for response because so many people are calling about COVID. I haven't had to thankfully call myself, so I'm not aware. But if you call and you get through and you're able to talk to someone, that's valuable. But if you call and there's a 3-day wait, which I've heard for some cases there is, then it's less of a helpful resource. But your family doctor may be able to get in touch a lot sooner. And if you're really feeling unwell, then you should access the hospital. It's a safe place to go. I think Dr. Messenger, who's the head of emergency medicine at Kingston Health Sciences, for example, was saying that it continues to be a safe place for people to go, and people who need care should be going there.
Okay. Last question concerns the debate at City Council last night. The idea that we have asked the provincial government, we've not taken any steps to open anything up, but we've just asked the provincial government to consider regional situations, circumstances within the loosening orders. How do you feel about that?
Well, I think there's a lot of evidence that of how to begin to take the next steps. So the WHO has outlined a number of steps. There's 6 criteria that they've outlined that the regions have to have. One of those is a control on the number of cases in your community, and we've seen that regionally. We've seen that in many areas of the province, not just Kingston, but not all areas. So while we're interconnected, we may have an opportunity to proceed in some ways and serve as a model for other areas. When we say open up as well, it's not a light switch that we flick and everything goes back to the way it was six months ago or 6 weeks ago. But as we saw when these measures were introduced by the province, they were gradually introduced, and there'll be gradual changes as well. Going back to that mountain analogy, at the peaks and the troughs at different times, we'll need to ease some of those restrictions, and we'll need to place some of those restrictions back on at different times, depending on how the virus is circulating. We know we have a certain healthcare capacity in our area. The government has instructed us to begin looking into other ways to expand that, and that then takes into account, for example, all the other care we need to continue to do, as we were just talking about earlier, and planning for the future as well, and making sure that we are able to care for everyone who needs it. Because as we know, as we start to expand what we're able to do, there will be cases that pop up here and there. And our goal in public health and as a province is really to make sure that those individual cases don't turn into big outbreaks. As we've seen elsewhere in the world, they can very quickly do that and overwhelm systems. And so we need to make sure we have the capacity to find people who have it through testing, isolate them, find their contacts, isolate, quarantine, or ask contacts to self-monitor, and then have the healthcare capacity to treat the people who do become unwell as a result. And most people who get this won't become unwell, but we have to be ready in the event that they do become unwell, because we want to avoid the worst case.
So as the sun comes out and the parks become enticing, they may allow us to say, yeah, the parks are open again, but emphasize the fact that if you're taking that walk in the park, that you're staying 6 feet away from others, that you're washing your hands, that you're doing all of the other things. This is not, as you say, a light switch that, yeah, go out and play football with your buddies.
Yeah, exactly. So it's going and doing things to make sure that we consider the whole health of the individual, not just the one aspect of health related to the COVID-19 illness, but our mental health, our physical health in general. The other day, I was out raking leaves in my backyard, and who knew raking leaves could be so much fun? It's the first time I think I've ever really enjoyed that, but it was so nice to be outside. And so when we do that, we'll have to continue to be safe and ensure that we don't help to spread the virus, but keeping the rest of our health in mind as well.
I'll take your word for it that raking leaves is fun. I usually avoid it in the fall and deal with it in the spring.
Well, that's what I had to do. Exactly.
So yeah, it's I think that we'll get a little bit more mental health, I think, and people will not feel, I think, maybe as cooped up once they can get out a little bit. So we've got to take care of the whole person, right?
Yeah, exactly. And it's beautiful outside right now. So taking that time to ensure you get outside, get some fresh air, but do so in a safe way, exactly like you're saying. And I think our community has shown that they're really responsive and taking it seriously, and will continue to do that. So that's really reassuring from our perspective, that we don't need to worry about a slippery slope where we may go down a path that then turns into something more, because our community has shown that they are willing to take the advice, even as it presents its own challenges to everybody.
Well, that's a very positive, optimistic way to leave this for this week. We'll talk to you again next week, Dr. Kasmani. In the meantime, stay safe and get some sun.
Thanks for having me.